everyone. So my name is Khushi Gandhi, and I'm working on the project known as Characterization of Nanoparticle Uptake in the Nano-SMART clinical trial. I'm a part of the Barbeco lab at BWH and Dana-Farber. So the purpose of this project is to have an adaptive phase 1-2 trial of Aggies gadolinium-based nanoparticles with stereostatic magnetic resonance guided adaptive radiation therapy for centrally located lung tumors and locally advanced unresectable pancreatic ductal adenocarcinoma. So the impact of this project on nanomedicine is very unique because this is actually the first clinical trial using gadolinium-based nanoparticles for the treatment of pancreatic cancer. Throughout my literature review, there's been many other types of nanoparticles utilized in clinical trials up to in vivo trials. However, this type of nanoparticle is very special and has shown a lot of promise. It targets a very aggressive type of cancer and shows great promise for treatment as well as the eradication of metastasis. And what I'm currently working on is the computational side to the clinical data that we get and trying to see the amount of uptake from the specific nanoparticle to see if it's great for human clinical trials. Now, for the CaNCURE co-op experience, it was definitely something new I had encountered on since it's just a group of 8 students who have embarked on nanoparticle research and nanomedicine, which is a relatively new field. It gave a new perspective to cancer research because a lot of people think that a cancer treatment is just limited to chemoradiation or surgery or any other or immunotherapy. However, there's a lot of research behind the scenes that a lot of people don't know about. When I went to go shadow Dr. Lehman at BWH, it was a great experience for me to see another side to oncology treatment as well as the research. I was able to see a team of radiation therapists and technicians working together to provide treatment on a real-time slot where you were able to see the organs in real time, and it was just a great environment to be in. I was also able to see the treatment process and real-time imaging that showed a lot of collaboration communication, which was a new aspect to oncology that I had not witnessed before. And then the software that I'm using is also a very relatively new type of software that allowed me to jump right in and try to take on a whole new computational software on my own and trying to see how I can best use that for this research. Now, for some technical skills, as I said, the software we used was MIM, known as Medical Image Merge, and I was able to do techniques such as contouring and registering, which allowed us to acquire a lot of statistical data. I was also able to learn a lot of quick basic anatomy from the MRI scans, the fraction data, and T1 maps, and I was able to utilize Excel to put together all this data. As you can see by this graph, this is just an example of a patient who I had gathered data for in terms of fraction data, and you can see the uptake depending on what organ or part of the body it was. Now, with my rest of the time on co-op, I hope to see the paper publication process as all of this is going towards a paper, as well as to see the MATLAB coding process behind the scenes. Now, the most valuable skill that I think I learned was the ability to learn a new software so quickly within the first month of me being on this co-op. It was pretty independent. I think it gave me a great exposure to see how I could better use my previous computational skills to this one. And then the in-person clinical shadowing also gave me a new perspective on how the clinical scans originated, as well as the MRI LINAC machine, which is definitely a great experience. As I don't know if you know, but the MRI LINAC machine is actually going to be discontinued and they're trying to get a new software, but it was great to see it for this specific clinical project. Now, for future experiences in co-op, obviously I have worked with cancer research and I still want to be involved in some sort of field within oncology, but I'd like to be a part of the clinical side and get more of the patient-human interaction, which involves maybe being an MA or just working as some sort of nursing assistant with cancer patients in their activities of daily living, because I could see how everyday lives go for these patients aside from them getting clinical trials or like treatments. Even further going around my career path, medical school research could also be focused on nanoparticles and radiation oncology. I am also part of another lab dealing with lung cancer, and hopefully this nanoparticle research and that research could collaborate in some way. And then a part-time job may be involving being like a radiation oncology technician, which was great to see in shadow when I did go to BWH. And yeah, that's all. Thank you.